Hello, I'm Dr. Mike Milligan. I'm here with Joel Blitz of SomnoMed out of Denton, Texas. They have the SomnoDent oral appliance. Joel, thanks for being with us.
Thanks for having me, Doc.
Joel, tell us a little bit about the SomnoDent oral appliance.
Well, I'll tell you, the SomnoDent MAS is our answer to treating OSA, or obstructive sleep apnea.
Okay.
And we've basically built a network of dentists that are delivering our medical device to treat those patients with OSA.
Okay.
And
it's a great service. There are a lot of people out there who need this.
Yes, sir. Yes, sir. There's millions of people are undiagnosed or underdiagnosed, and a lot of the screening that takes place starts with the dental office. And the SomnoDent MAS is considered the most durable and comfortable and effective solution other than continuous positive air pressure or CPAP therapy.
CPAP. And I have my mother and I have a brother-in-law on the CPAP machine, and it's, you know, they don't like wearing that thing. So this is a great alternative.
This is exactly the device that should be used or recommended from sleep physicians for those mild or moderate patients. When we talk about severity of OSA, there's mild patients, there's moderate and severe cases. When they stop breathing for longer than 10 seconds, that's called an apnea. And I think a lot of folks may not realize that when you don't breathe for that long, it has a detrimental effect not only on the heart, but the brain and the vascular system.
And this can be long-term if let go.
Oh, yes, sir. This is really helping those patients that are having health risks, such as possibility of stroke or cardiovascular disease, get that good night's sleep, help the body regenerate in that deep sleep, and get an effective therapy for something that's not as intrusive as continuous positive air pressure or even intrusive as surgery. So there's millions of folks that could use it, and raising awareness and screening patients is where we're starting. The SomnoDent MAS is our mandibular advancement splint, and it's a unique device that doesn't have a locking mechanism. It's designed to keep the mandible from falling backwards. It's actually built in a protrusive state so that when the patient engages the appliance, they'll first put in the upper and then seat the lower by advancing their mandible. And then when the natural elasticity of the ligament draws back, it engages the fin coupling mechanism here and doesn't allow the mandible to fall backwards. Again, very unique that it doesn't lock a patient into an occluded position. It's no lingual impingement, very elegant and sleek design, and clinically proven to be effective in treating OSA in mild and moderate cases, and even in severe cases. This is a device that patients are looking for, and they'll ask for it by name. I have my Flex acrylic, or pardon me, my SomnoDent Flex MAS in my hand. May I change it? I totally screwed.
Absolutely, you're good.
The SomnoDent acrylic is using ball clasp retention. You'll notice that the devices side by side, the Flex and acrylic covers the occlusal surfaces. The Flex device has a little bit more bulk, encapsulating the tooth with sucked-on retention. But both devices are adjustable and unique to the fact that they can be bilaterally adjusted rather than unilaterally. So it's actually very effective with TMJ patients, as well as people that need more comfort and freedom with range of motion vertically as well as laterally.
Joel, thank you very much.
Thank you very much, Dr. Mike.
All righty.
Thanks.